Well, good morning, everybody, and welcome to today's session where we will be looking at oral expressive and receptive language. And before we start, I just want us to be cognizant of what you will be able to do after today's lecture. You will have knowledge of the approach to language difficulties. You will also be able to just define language difficulties and know which areas of language must be assessed. You will become aware on how to interview a learner regarding their language and also know how to use the assessment tools that are part of your SNAR documents in regards to oral, expressive, and receptive language, and also understand the importance of keeping record. I just want to mention that the slides are also available on the Moodle platform. If you are experiencing difficulty, perhaps in regards to the slides being visible on your side, please let me know, or otherwise, please download the document itself on the Moodle platform. Again, give me a thumbs up if everybody can see the slides. Okay, I see people in the chat are indicating that they can see it. Okay, so it should be visible for everybody. Okay, so Spindile, I see that you can't see the slides. I would advise you to perhaps give it some time. Maybe your system is just configuring. And if that doesn't work, I would encourage you to download the PowerPoint from the Moodle platform. And so we will also know how to do a curriculum-based assessment for oral expressive and receptive knowledge techniques that Dr. Fourie has touched on her session this morning. So let us just lay the premises in order to understand what it is we actually need to do with the tools that have been given to us when it comes to scholastic assessment. And in order to understand the tools that you are currently making use of, you need to understand the premises or the foundation or the frameworks which informs those tools. And so let us start off by just trying to understand what language disorders are. Now, it is important to know and understand that language disorders differ from speech disorders. And while speech disorders affect pronunciation and voice, as well as fluency, for example, learners who stutter, or learners who have articulation problems. Language disorders are much broader, so they involve difficulties in understanding or using words and grammar and forming concepts or comprehending language. And so language disorder and learning are obviously, they correlate in terms of how the child is experiencing the learning process. And many learners with learning disabilities have underlying language disorders. Now, research has uncovered that that some experience language delays, such as not speaking by the age of 4, while others use language with unusual syntax or inappropriate word choices. For example, a learner would say, why not don't he eats? Or instead of saying, why don't he eat? And so these challenges can really occur even in rich language environments, especially in a context such as South Africa. Now, research shows that early issues in oral language, especially in preschool years, often lead to later struggles in reading as well as writing. Now, poor readers tend to have a smaller vocabulary. They also have less verbal fluency and difficulty with grammar and phonological processing. Now, when it comes to the different types of language disorders, we need to understand the different forms of it. There is the receptive language disorders, and this is difficulty understanding spoken language. And then there's also the expressive language disorders, and this is difficulty using spoken language. And then we have the global language disorders, which is a combination of both understandings and producing language. Now we need to dive a little bit deeper into understanding the different forms of language disorders, because all of the forms that I've mentioned interlink together in order for a child to engage in oral expressive engagements. And so children with receptive language disorders might perhaps understand simple words, but they might struggle with full sentences or more abstract meanings. For example, they might understand chair and candy individually, but not in the sentence. If you perhaps use those words in a sentence and you say, sit on the chair after you eat the candy, others may fail to understand a word using in the different contexts that you might be using it in. And so others might also get confused about the context of the word that you are using. For example, the word run as an action word versus the word run in baseball. So some children have trouble just recognizing perhaps pitch or even blending sounds. And these are skills vital for phonological awareness. And others may not even notice small words that are part and just change the meaning of those words. For example, the differences between the cats eat and the cats eat. And so it is important to be aware of these foundations as you are busy engaging with the child in regards to the scholastic assessment. And then we also have the expressive language difficulties. Now, these can involve difficulty recalling or perhaps forming words, and children with dysnomia might talk about a forgotten word where instead of using the word, they will, for example, if they have forgotten the word tomato, instead of using the word tomato, they will start describing a tomato as a round red thing that rhymes with potato. And so that will therefore be an indication that there is perhaps difficulty recalling or perhaps forming words. And others may struggle to form complete sentences or even manipulate speech muscles correctly. And this is a condition that is known as apraxia. And so we also need to be observant and be present as assessors when we engage with the assessment tools that are part of this module. Hence, the emphasis given on observation in the previous lecture. And then there's obviously the global language difficulty or disorder, and children with developmental aphasia, and that is the term that is used to refer to the global language difficulty. Now, the children with this developmental experience obviously are those who have severe challenges acquiring language due to the central nervous system issue, which Dr. Fourie spoke on when the question was posed in regards to gauging whether the child has developed the skill or not. And so we need to therefore understand these different types of forms because it will all bring about an understanding whether there is a reason why perhaps a central nervous reason why a learner might have difficulty in listening and speaking and reading or writing. And so that therefore brings me to the following conversation, and that is just being cognizant of the fact that South Africa is a multifaceted, multicultural, multilingual community within communities. And so looking at language and learning through a South African lens when working or when engaging with your learner is of uttermost importance, because it's important to understand that a language difference is not the same as a language disorder. And for example, like in South Africa, many children grow up speaking like regional dialects or home languages like isiZulu, isiXhosa, Afrikaans, isiTswana, or any other South African language apart from English. And that may not follow the same grammar or the vocabulary as the English used in formal education. Now, we all know that the different languages are fully developed language systems. They are appropriate. They have meaning within their culture as well as in their social context. And speaking in a non-standard or home dialect is not a sign of a learning problem. It simply it simply reflects a difference in linguistic backgrounds. And so a mismatch between the language spoken at home and the language of instruction at school, which is often standard South African English, can sometimes make academic tasks more difficult. This is especially true when learners are expected to use abstract as well as technical language in subjects like science and maths or literature, or when assessments basically rely heavily on English comprehension and vocabulary. And so we need to recognize the difference between a language barrier and a genuine language disorder, or which is key in just keeping keeping to the awareness of it as you engage with your case child, because without that understanding, children may be mistakenly referred to learning support when what they really need is more time and support to master the academic English. And so we need to keep that in mind, because that will also, if you are currently, or if for this year you are doing the learning support module, your findings in this module will inform how your learning support will be framed and structured, as well as the referrals that you will be required to make. And I think, not I think, it's a fact, because I sat um, in during the lectures. Dr. Puri emphasized on that importance. And so in South Africa's multilingual society, we need to keep in mind that many learners speak a language other than English at home. And we know that we have a lot of languages, and some children grow up bilingual, which can, according to research, can actually boost their thinking and problem-solving skills. But there's also the other side of the reality, and that is that others have limited English proficiency and may struggle to understand the use of English, especially in academic environments where English is the primary language of instructions. And if you think about it as well, most of the schools who are English inclined, they make use of English study guides, which is part of their curriculum. And so all of that influences, obviously, how the child will learn or is currently experiencing the learning environment. But we also need to keep in mind, and this is something that I've been in conversation with some teachers locally, and that is the fact that a lot of parents, for some reason, also insist on putting the children into primary English schools, even though sometimes schools do offer dual language options. But parents make that decision to put their child in predominantly English school so that they can develop the language. However, a lot of learners do struggle, and that needs to be taken into consideration when especially when you work with the learner, but also as you engage with the parents. Hence, the interviews are so important. And remember, I said that the interviews might have been initiated, but it's not once off. It should be ongoing. And should be part of the entire process, because as you uncover certain 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 indicators in terms of your engagement with the case child, those your findings will bring about questions which perhaps parents can consolidate. Hence, the importance of continuous conversation, continuous interviews with parents until the process has run its course. And so I also want us to also be cognizant of the fact that let me just, didn't speak on this, but also be cognizant of the fact that that for many learners with learning difficulties, now these challenges often show up in both their home language as well as in English. And we need to be aware of that. And that's why it's so important to carefully assess whether a learner's struggles are due to a language disorder or simply because they're still learning English. And that brings me to the approaches that we are all aware of, which are part of our structures in the South African system. And there are the three main approaches that schools use to support English language learning in all schools. We have the English as a second language structure, and this method basically just focuses on helping learners build English skills through repetition and structured lessons and speaking practices. And then we also have the bilingual education, and that is for learners that are taught in both their home language as well as in English. And the goal is to basically just support learning by building on what they already know in their language. And then we have the immersion, where learners are fully immersed in English with little or no instruction in their home language. And they learn through constant exposure and everyday use in the classroom. And each of these methods obviously has its strengths, but we still need more, I think, local research to keep on uncovering our understanding of how well they work for learners who also have learning disability, especially with the pace in which the conversation of neurodevelopmental disorders are finding residence within our schools and our communities and our higher institutions. We also need to be very clear about just understanding the context, in that research obviously shows that teachers as well as schools need support, and they need proper training, not just in special education, but in ordinary public schools as well as in full service schools. But more importantly, I think research needs to continually uncover and unpack how to teach English to learners who speak other languages at home, especially in a country as linguistically rich as South Africa. Education strategies need to reflect, and I think, and they need to respect that diversity. And I think the more teachers understand, and the more they are empowered in terms of understanding these approaches, the more they in turn can advise parents in terms of the best decision for their children. But for now, there is the belief out there that English is equal to your IQ, and that is a thought that we've inherited at the cost of surrendering our own linguistic systems. And I think we need to start appreciating, what we do have in order to use it as the foundation to build on what we believe needs to be developed. And so for me, that is very important that research within the language spaces within the South African context continue. And so when it comes to the assessment of receptive and expressive language skills, it is important to understand that the assessment process in itself is set in motion or just set in place to help determine a learner's language abilities, but more importantly, to also identify their needs. And this includes evaluating both listening, which is basically the receptive, as well as speaking, which is the expressive skills. Now, there are formal assessments as well as informal assessments. And with the formal assessments, they are just standardized tests that are offered through structured data on auditory discrimination, which Dr. Furi emphasized on. And that again, if I can just again remind you of what that is again just in terms of helping learners just tell similar sounds apart. And so like pen or pin. And then we have receptive and expressive vocabulary, and that is what learners understand, and expressive is what they say. And both are basically essential for everyday communication and learning. And then we have the grammar and the syntax. And this basically just covers the sentence convention and structure, like using correct tenses and word orders. So learners speak and write clearly and accurately, as all of that plays together or influences each other, as you will discover in our units that we will be reflecting on going forward in terms of reading and writing, and how all of that are interlinked with everything that we are talking about presently. And then we also have word finding and phonological awareness, which is just finding and recalling the right word. And phonological awareness is just playing with sounds, both and then both of these basically just boost language and early reading skills. And if we take a deeper dive um, into the formal assessments that are available. One test that have been shared with you is the Weapman Auditory Discrimination Test. Now, it is important to understand the part that this test plays in in this process. And so what we need to understand is its purpose. And the purpose for the weapon is just to help us assess auditory discrimination skills. And the name is the function of it, or its purpose, is within the name itself. And this is the ability to hear and differentiate between speech sounds, right? And this is important for language development, particularly in learning to read and spell. Now, how does it actually work? Now, Dr. Furi gave an illustration, and I don't know whether everybody was in the room, but I'm just going to give you an illustration again so that if you have missed it, at least you have the second illustration given to you. So children are just presented with pairs of words, for example, bat and pat, and they have to say whether the words are the same or different, right? Um, and you give them the word, and you then mark it according to the sheet that was provided to you. But you're also very observant in that moment. You need to be present. Um, Regardless of the fact that you will be engaging in the activity with the child, you need to be observant, perhaps, about other factors that might play a part in why the child might be responding in the way that the child is responding. Are there pauses in regards to the instruction given to the child and the child's response to the, and how long is that pause? Look at and observe the child's body language as well. So you need to be present in a moment so that you can use the experience and the exposure to also speak or bring in context into the data which you are collecting. And so observation is key, and observation is important. Hence, observation will always be part of our conversations, and it is part of the informal assessment approach. And I've spoken about it in the previous session, and I'm not going to take a deep dive into it in this session, but just mention it to you, that observation happens during your engagement with the case child, or whether you choose to go and observe the case child within the classroom while the child is busy with the academic activities or on the playground. It is important that we make use of the observation approach in the entire scholastic process. And then also you have been provided with rating scales. And so apart from the rating scales that are part of the SNOD document, there are also parent and teacher rating scales that you can download, and that I have made reference to in the previous unit. And so you make use of these tools just to help you develop a bigger picture and a much more holistic picture of who this child is that you are currently working with. And then we have informal story comprehension task, and I will just dive into it deeper later on, as that forms part of the curriculum-based approach to assessment. And then with regards to the informal assessment tools, when making reference to checklists and the oral, receptive, and expressive language. Now, this is obviously used by both teachers as well as therapists, just to monitor a child's development and in understanding language and using a language in their natural setting. And so these tools help the observation process, in that it helps funnel that which we need to pay attention to, and that which serves as important information in regards to understanding the learners even better, instead of just observing learners blindly. Now, checklists can include behaviors or skills that the child is expected to demonstrate at certain development levels. And depending on your case child's age, you will use a checklist. Apart from the checklist provided, if you choose to use other checklists, you will use checklists that are appropriate for the purpose of the assessment that you are currently undertaking. And so it can be a checklist that can do receptive, look at the receptive language examples of learners, whether learners can follow simple directions. For example, if you give an instruction to the learner to go and get a shoe, whether the learner is able to react and follow through. And then also just understanding basic concepts in terms of big and small, in and out, and then also using expressive language examples, such as using age-appropriate vocabulary. And because we all are working with children who are at different stages of their development, it is important, that you make use of appropriate vocabulary. If you're not a teacher, to engage with the teacher and perhaps request the type of vocabulary that he or she is making use of within the classroom. If you are a teacher, to make contact with the teacher of the case child in order to develop your observation, or to develop your checklist meaningfully for the child. And then also forms of simple sentences like I want juice, and just allowing the child to either develop or complete, whichever way you choose or whichever technique you choose to apply, for the child to follow through with those instructions. And so if you, as an assessor, use this as part of the assessment process, you will be able, it will help you just to identify delays or the strengths in language use, and to just help guide referrals, or to help you develop interventions if it is that you are busy with the learning support module as well. That is part of the program. And then also the phonological and phonemic competency tool that was provided to you, which just evaluates a child's understanding and the use of phonological awareness, how this works, and Dr. Puri also touched on it, And how this works is basically making use of rhyming, making use of syllable segmentations, phonem identification, as well as just blending sounds. Now, often used during school readiness screening, or perhaps during early grade assessments, um, just to gauge and to see if the child has the sound-based skills needed for literacy in the language of learning and teaching. And so understanding the premises of the tools are important, how to apply them, um, by making use of the technique approaches that was shared with you in the previous module as well. And that is where the curriculum-based assessment for oral expressive language comes in, because language learning doesn't just happen through passive exposure, right? But through actual interaction. So children learn best when they engage in back and forth communication. And so there are activities that you were referred to in the previous session that really enhances the oral language of learners. But in the same breath, those activities can also be used in order to help you better understand the case child that you are currently working with, right? And by you having conversations and perhaps role playing or bring that into the assessment process, that will help you observe, but also practice speaking in meaningful ways. Because I believe that assessment shouldn't just be about getting to the data and finding out what the needs are of the child, but assessment should be a therapeutic experience altogether. And so it is about not just trying to get to the data, but also perhaps bringing in components into the assessment that will allow you to observe the child in real time, with with activities that that are basically designed just to help um, enhance, but also gauge whether there are gaps. And there's also the objective discussions where you ask learners to describe size, color, shape, and function. There's categorization, where you sort items into groups. And then you also have comprehension questions, where you encourage critical thinking. And then my favorite is obviously story completion. And it is my favorite because normally when I make use of story completion, I make sure that I know I know much about the learner, um, in terms of the learner's interest, and I bring that interest into story completion just to see whether if the learner is interested in what is being done, whether the learner will apply themselves. And then also, comparing it with a story that perhaps is not contextually or even culturally or age relevant. Well, age relevant in terms of, when I say age relevant, I mean in interest for the learner. And then I just see whether, you know, what how did the learner approach both stories? And that will help me understand, okay, perhaps if I am conscious about the learner's interests, then that to some degree is a strength that can be used for learning support purposes. And so all of those things are triangulated, thought together, applied in the approach of assessment to just understand learners holistically. Um, because learners with expressive language issues, they need structured opportunities just to practice talking, just as learners with reading challenges need time to read. And so that brings me to, and also being aware of the predictable sequence in learning language, which is seen as just the typical flow of language development. And that is just being cognizant of the fact that when learners are between 0 to 9 months, they are babbling, up to where they are 3 to 6, where they're starting to use perhaps complex sentences. And we need to just be aware of these development stages, because learners will be in different stages of their development. And if a learner, and that is why it is also important to keep in mind the interview you had with the parents. And that is why part of the interview process is just understanding the development of the child, to see um, whether the child has met all milestones, because children with language disorders may just miss or delay in certain stages. For example, if a child who never babbled or imitated words, that child may struggle with verbal expression later on, if there wasn't enough stimulation or interventions put in place. And then just very lastly, second lastly, I just want us to just remember that expressive language is about producing speech, and that receptive language is about understanding speech, and that both are essential for communication and learning. And if you look at the pyramid on the side, you will see that all of what we spoke about are part of the building blocks that helps a child performs at a school that, or in a system that is very much dependent on what we reflected on, and that is communication. And so assessments and intervention must be individualized and culturally sensitive, and that early targeted support is key for helping children succeed. Now, just lastly, according to research, um, and this is just an interesting table that I've put together with the research that is currently out there. But the research that I was looking at was at language intervention approaches. But I was also very interested in the key strategies, but also the context in which it works in, because not one shoe fits everybody. And so I'm always interested in terms of the context, and how strategies which are out there how those strategies apply to the context, especially within a multicultural context such as South Africa. And so over here, it's just a table of language intervention approaches that have been applied, especially within the South African context. We have the oral communication, and this is the strategy here is just to encouraging is to have an encouraging environment and to have tailored strategies. And this is normally used in rural technical students, among rural technical students. And then we have the systemic intervention, which is a holistic approach, which is informed by social, political context. And this is the context relevant for this is the children with developmental issues. And then we have the language enrichment intervention approach, that is inclusive classrooms, early identification, and this is for all school age children. And then we have the communication techniques that is always referred to, such as paraphrasing, substitution, and motivation. And these are normally used for foreign language learners. And then we have the speech and language therapy, which is hybrid interventions and intensive therapy. And these are for children with SLD, right? And these are implemented by trained professionals, registered professionals. And then we have the multimodal intervention, which is the social skill training and collaborative planning. And those are for individuals with ADHD and ASD as well. And so these are the strategies and the approaches, but also the context in which these strategies are currently being used within the South African context. Okay. And so thank you. This is the end of my unit for today. I just want to close off by saying you need to remember that everything you say to your child is absorbed, cataloged, and remembered. And if we are conscious about the power and the impact of communication, and the need to help learners perhaps overcome those barriers, we are changing lives one child at a time. If we are able to be conscious about the child's needs and do justice with the tools that we have been given to uncover what those needs are in order to make decisions that will serve the child. So thank you very much for your participation in this unit today. I want to encourage you to continually attend the tutor sessions where the tools are brought to life and practically engaged with you. So please continue attending your tutoring sessions. If you do need consultations, please do not hesitate to reach out to me. Those consultations can happen online or it can be face-to-face. Thank you so much, everybody. Thank you, Dr. Fori.